Today we're discussing how to make a man look more hot and also revealing the answers to last week's Guess What We Did. A question people often ask is, how do I know which areas of the face I need to change or augment in order to make somebody look more classically attractive? Well, there's quite an easy way to find out which areas you might want to change and get yourself back to that golden proportion ratio. I'm sure you all know what I'm talking about. It's the phi ratio. So phi is 1 to 1.618, and this is a ratio that we see replicated in many forms of beauty in nature and also in classical art and classical architecture. It's something that we can also measure and use the ratio for in the face. So I use something called calipers to measure this in a lot of my patients. And what I'm going to show you now is how we apply this to doing a facial assessment. When we do a facial assessment, we divide the face up into thirds. So you would have your upper facial third, middle facial third, and then your lower facial third. It's just an easier way of identifying any areas that you might want to change. In the upper facial third, we would be looking for things like any volume issues in the forehead, any fine lines and wrinkles, the contour of the brow, any temporal hollowing around here as well. And on a male, it's a little bit different to assessing a female because it's fine to have a little bit of frontal bossing here. That's where you have a bit of heaviness across the eyebrows. It looks a bit more masculine and more manly if you have that present. With the temple, on a man, I like to see a little bit of hollowing right here rather than convexity. And in addition to that, the brow should be straight. The takeoff distance of the brow should be around 0 to 10 degrees. Any more than 10 degrees and like this, and it starts to look a lot more feminine. So horizontal or up to 10 degrees is absolutely fine. Another important thing is the distance between the beginning of the eyebrow and the canthus of the eye, which is this area right here. What we want to do is measure the distance between the eyes, like so, and then you take that distance, and with our phi calipers, we measure this distance here. And this should be 0.618 of this distance here. It's just one of those things that can help someone look a bit more attractive. If this distance here is too small, then it can make the eye appear smaller. If it's too large, then you kind of look like your eyebrows are floating off your head a little bit. We also want to be having a look at the length of the eyebrow. So we take our calipers, measure the distance between the canthus of the eye, and up until the first point of the brow here, the peak of the brow, this distance should be the same as this distance is here. The whole length of the brow to the tail of the brow should be 1.618 of the distance in between the eyes. If you have a lack of hair in the outer third of the eyebrow, it's very possible that you may have some subclinical thyroid issues, so it might be worth having that looked at. Now we're going to look specifically at the cheek. And on a man, the cheek is a little bit more forward facing and lower down in the face than it is on a woman. So we're going to reflect that when we do our treatments. And the way that we discover the correct area to mark up to do our treatment is as follows. So what we do is we drop a line down from the lateral part of the iris to the corner of the mouth, like so. We then drop another line down from the lower part of the tragus. The tragus is this part of the ear, you know, the bit that sticks out that some people have pierced. You drop that line down straight again to the corner of the mouth. And then once you've done this, you bisect that triangle. So you drop one line straight down to bisect the triangle like so. Then with this bisecting line, you split that up into thirds, and you want to take, that's approximately correct, you want to take 2/3 to the bottom and then 1/3 to the top here, like so. And that's where you want to be. You can verify that this is the correct position by taking that distance, this distance between the canthai of the eyes, and ensuring that it is the same as this distance is right here. So this is where we want the peak of the cheek to be. So now let's look at the lower third of the face, at the chin and the jawline. Again, we have to measure this intracanthal distance, which is the distance in between the eyes, and then we apply that distance to the chin. We want the width of the chin to be 1.618 of the distance in between the eyes. That's the phi ratio, the golden ratio. Now this isn't the same as it would be in a female, because in a woman it should be a distance of 1 to 1, meaning that the width of the chin is the same as the width in between the eyes. And then when we look at the width of the mouth, that should also be 1.618, the phi ratio. So here I have in front of me the products that we used to get our fantastic result for our patient last week. Here we've got a Botox pen. It's actually called a Juva pen. Now this is used to introduce Botox or botulinum toxin or whatever brand it is that you want to use into the skin in a really, really controlled and almost painless way. Of course, you know, there is a needle going inside the skin, so it's not completely without sensation, but it does really take the edge off. And that's something that we're going to explore in a future video, in like maybe 2 videos time. So can you guess which areas we injected with Botox on our Guess What We Did patient? Of course, the classic 3 areas of Botox. So he's a patient who likes to look, you know, really smooth in the forehead. He likes to have quite a, you know, a bit more of an augmented look, which is fine, suits him, and he's definitely young enough to be able to get away with that. If you have a look at the position of his brow, you can see that before, his brow is a little bit more arched in the center, and after we've used the Botox, it's much straighter, which is a really masculinizing trait. So it makes you look, you know, more guy-like if you have a straight eyebrow. The next thing that we did was use this product here, Juvederm Voluma. Now this is one of my go-to products. I use it very, very frequently because it's got really good lifting capacity. It's a hyaluronic acid. I'm sure you've all probably heard of Juvederm already. And it's got really good longevity. So if you're lucky, you'll get about 18 months from it. Of course, it varies, you know, person to person and where you inject it on the face, but, you know, around 18 months is a good guideline. So you can see with this particular product, we're going to inject the front portion of the cheek and the lateral portion of the cheek, and I'm using there an injector pen, which makes it a little bit more comfortable for him and gives me a bit more control. It's very, very important when you're augmenting the cheek, especially in a male, to remember to do the front portion of the cheek. If you just do the lateral portion, it can make you look quite feminine or even alien-like, because, you know, your cheeks are like entering the room before you do because they're so projected. You have to keep everything in balance, everything in harmony. So the first thing we do is we add Voluma to the front portion of the cheek, using a cannula, using the pen to give him projection. Now we're going to do the lateral portion of the cheek, which we can get away with because we've done the front portion. The reason why I'm choosing Voluma for that area is because he needs quite a lot of projection, but I also want to choose something that's soft. The problem with choosing a harder filler in that area is when he's smiling and moving his face, you're going to be able to see it, which is an absolute dead giveaway that you've had something done. And of course, nobody wants that. Shh, it's supposed to be secret. The next thing that we do is use this product here, Radiesse. Now I'm using Radiesse Plus, which means that it's Radiesse plus lignocaine. most fillers have got lignocaine in them to make it more comfortable. It's an anaesthetic agent which just numbs the area, so afterwards you don't feel so much pain. So Voluma has lignocaine in it as well. Now, in the old days, back, you know, in the olden times, like maybe 8 months ago or something like that, Radiesse didn't come with lignocaine in. We had to mix it ourselves. So that was a bit of a pain. And, you know, it changed the properties of the product a little bit. So much better to have it already in there. So you can see I'm using a cannula again, which is a blunt-ended needle, which allows me to reach a wider proportion of the face just from one entry point. So it's a little bit more elegant using a cannula. You know, there's less entry points, less risk of bruising, less needle holes for the patient. And you can see I'm doing the angle of the jaw here just to really make that pop out. It's a very masculinizing trait to have a nice strong jawline. I'm not saying the ladies can't enjoy a strong jawline too, of course they can, but if you're a guy and you have a bit of a weaker jawline, it makes such a difference if you just crisp that up a little bit. Now we're going to move on and do the chin. Same thing, using Radiesse in the chin. Remember those golden ratios, those phi ratios that I gave you before. So we want the chin to be 1.618 of the distance in between the eyes. So we're just widening that slightly here, again using Radiesse with a cannula. Now we can see the whole of the right side of the face has been treated. So you can see the front part of the cheek, the lateral part of the cheek, the jawline and the chin have all been treated. And now compare that with the other side. So compare that with the anatomical left, which is right on the screen. Sorry to be so confusing about this. And you can see that he just looks better. So he looks like he's got a little bit older, maybe a little bit wiser, who knows, but in a very good way. And that's the sort of thing that we can do using Botox and dermal fillers. Okay, so that's all we've got time for today. Join us next week where we're discussing the dangers inside your sunscreen. In the meantime, please like, comment and subscribe. If there's anything that you'd like to know or any comments that you'd like to make, just add them below in the comment section.